We're mostly a re-granting organization. We worked with capacitation of other nonprofit organizations doing the work. Once the pandemic hit, it kind of blew up in our faces, and then we had to act emergently. So we decided that we had to begin working with families directly, providing relief for rent assistance, utilities, and medical bills.
One challenge that we had was convincing people that it was okay to go to the hospital and calming their fears and their concerns about going.
Yes.
To give an example, we had a partner from Athens reach out to us because someone had reached out to him from DeKalb County. He was a man who was a janitor, who was undocumented. I think he lived with like 6 people in his household, including a baby, and like everyone was sick with COVID. But him and the other provider who were both custodians, they were the most sick and they couldn't breathe. They were like at the brink of death. But they didn't want to go to the hospital because they were scared that because they were undocumented, that they would get deported. So we actually had to get someone we know who worked at Brady to call them and like explain to him how things worked. Explain to him that even though they do ask for form of ID, to take any ID, it's just to make sure the name is spelled correctly. And let them know that they're not going to be turned away because of their status. When you're trying to reach different communities, different immigrant communities, like language is not enough. It's not just about making sure stuff is in the right language. It's making sure stuff is culturally relevant, that it's written in a way that people understand. So not using too much medical jargon, that we offer safe spaces for people to come. We try to make sure that our vaccine sites are open, that people feel comfortable coming, that we have extra volunteers available who can speak Spanish and who can answer their questions, and can help them register. For a lot of service providers, if they want to reach the communities, the most vulnerable communities, they have to make their services more accessible. So
really, the resounding lesson here is that we have to meet people where they are. And we have to understand that for that to happen, we need to hire people from the community that we're trying to get to, because the Latino community, just like every community, is diverse, and there's no one right way to reach to the community and to speak to the community. And so that's why it's so important to include voices that are from the community, not only in the work, but also in the decision-making process.